Now at 7, fast-growing crisis, the coronavirus sparking more life changes for millions, including a new warning. Mayor de Blasio is considering issuing a shelter-in-place order.
And shopping shut down. The new changes coming to malls in one part of the tri-state.
Plus, honoring a tradition, the unique ways people came together to celebrate St. Patrick's Day during this pandemic. Good evening, I'm Chuck Scarborough.
And I'm Natalie Pascarella. New strategies for parts of our area as the coronavirus cases go up. We now know all 50 states have confirmed cases.
Here at home, that number is ticking closer and closer to 2,000 across the tri-state area. New York leads the nation with over 1,300 cases and 12 deaths. New Jersey now reports 267 cases with 3 deaths. And Connecticut, 68 cases, no deaths.
And in New Jersey, new action. All indoor malls and amusement parks will close at 8 tonight. In Hoboken, residents are being asked to shelter in place and not have any gatherings with more than 5 people.
And Mayor de Blasio says a shelter-in-place decision could be made within 48 hours for the city. The mayor also says hospitals could be equipped to test 5,000 people per day by Thursday, and alternate side parking is suspended until next week.
News 4's Ray Vieta is live for us tonight at City Hall with the pushback, Ray, on that shelter-in-place discussion.
Natalie and Chuck, the mayor and governor kind of at odds over this situation. The mayor saying we should prepare for the possibility of a shelter in place in this city in the next 48 hours, while the governor says there are no plans in place and that if anything, it wouldn't make any sense. Excuse me, I was thrown off by someone walking behind me coughing. The governor saying that if anything, there are no plans in place and that it wouldn't make sense geographically. So while they decide on that, the mayor is putting out a call for help for healthcare professionals, comparing this to a wartime situation. The opponent in this war, the coronavirus.
Tonight, more cases diagnosed and more expected. New York City Mayor Bill de Blasio putting out a call for help.
Anyone who brings healthcare skills to the equation, your city needs you now.
The fight to slow the spread of the coronavirus accelerating rapidly in the city.
I think New Yorkers should be prepared right now for the possibility of a shelter-in-place order. It has not happened yet, but it is definitely a possibility at this point.
A possibility that puts the mayor at odds with Governor Andrew Cuomo, who this afternoon indicated no plans are underway for a lockdown.
Different communities have different ideas, but at the end of the day, they have to be approved by the state, Errol, because it has to work statewide. You know, there's no such thing as a geographically isolated initiative that doesn't affect everyone else.
Meanwhile, much of the city already quiet. Schools closed. Teachers spent the day training for online instruction. Their task, to teach 1 million students remotely starting next week. Businesses already feeling the effects of restrictions put into place last night. Restaurants and bars only open for takeout or delivery. Even that is a struggle.
We try not to close it. We tried our best because they will be unemployed and a lot of people.
The city also working to up testing capacity to be able to administer 5,000 tests a day, with results taking 1 to 2 days. Testing, the mayor says, will be needed in the days to come.
It's not that long until we hit 10,000 cases. That's why we are racing against time to set up the expanded medical capacity in this city.
A grim assessment there. Still a lot of questions that need to be answered. If this sheltering in place happens, how will people get food, get medicine? Questions the mayor and governor hope to answer in the coming hours. We're live outside of City Hall tonight. I'm Ray Vieta, News 4 New York.
All right, Ray, thank you. Now to New Jersey, where Governor Phil Murphy has added indoor malls and amusement parks to the list of closures, which includes gyms, casinos, theaters. Right now, people in Hoboken are also being asked to shelter in place. News 4's Brian Thompson is in Short Hills with the story.
It is a small corner of New Jersey in Hoboken that is going under lockdown or shelter in place. That's what New York City is still talking about. As for malls like Short Hills behind me here, well, its lockdown does begin at 8 tonight.
I am directing effective 8 p.m. tonight the closure of all indoor shopping malls, amusement parks, and amusement centers across New Jersey until the current emergency ends.
On the day the malls closed, a shopper wearing a protective face mask seemed to symbolize the impact of this coronavirus. Few people were here at the Short Hills Mall anyway. Food halls all but empty. Many stores already closed by their national chains. Macy's closing all of its stores nationwide. And for some, like Vani Gupta, it's a hard hit.
Are you going to miss it?
Yes.
How bad?
A lot, like really bad, yeah. I think I go to the mall as like a good pastime, so it's sad that it's closing, but it is
Has
what
to
it
be
is.
done.
Garden State Plaza is perhaps the best-known mall in New Jersey, in a state that seemingly has them by the bucketful and that are a major part of New Jersey's economy. But to look at these empty hallways at Short Hills just hours before the state shutdown, well, you know this is going to be a hard hit, especially as some shoppers just shrug it off.
Once they're closed, that's okay with you?
Yeah, that's fine. We don't care.
Shopping won't be an issue in densely populated Hoboken, where people will still be allowed to go out individually to run or walk their dog, but otherwise being told to self-isolate. And in Hoboken, any gathering of more than 5 people will be broken up by police. Any group refusing will be issued disorderly person summons.
The policy requires people to stay home except for essential needs. The purchasing of food, care for a family member or friend, to get health care, or employment where remote work is not possible.
It's interesting to note that just 24 hours or so ago, governors of the tri-state were talking about gatherings of no more than 250 people. At the same time, the president was saying no more than 10 people should gather. Now, the mayor of Hoboken is saying 5 should be the limit. That is an exponential decrease over all the others. In the mall in Short Hills, Brian Thompson, News 4 New York.
All right, changing by the day, Connecticut now has 68 confirmed cases of coronavirus. Westport is reporting at least 20 people who've tested positive. Now the Fairfield County town is stepping up measures, even closing the playground at Campo Beach to discourage crowds. We spoke with resident Lisa Delinka over teleconferencing. Lisa was at a gathering last week with someone who tested positive. She immediately self-isolated, had symptoms, and is now waiting for results.
We all have to realize that staying home is not the end of the world. This will pass, and it's safer for everybody, and you just can't take the chance for people that could get really sick with this.
Mobile lab testing also being set up across Connecticut, including in Danbury, by appointment only. The governor says he does expect the number of cases to continue to climb, Chuck.
And Governor Cuomo says the battling the virus is all about the numbers, and if the number of hospital beds available now is any indication, this may be a battle that we are losing right now. The governor projects we may need as many as 110,000 beds. As of now, the state has fewer than half that number, only about 53,000 available beds. This was Adam Cooper-Stevens in Washington Heights with what else hospitals need now.
Hospitals need more beds, more ventilators, more workers, and now nurses tell us there's even a shortage of those N95 masks that are used to protect them against coronavirus as they go onto the front lines during this crisis. 45 days from now, that's when Governor Cuomo says coronavirus infections in New York will peak. Problem is, right now, the state only has 53,000 hospital beds and could need up to 110,000. Even more dire, the state currently has 3,000 ICU beds, but say they could need 37,000.
This is about numbers, and this is about facts. This is not about prophecies or science fiction movies.
New York State also needs ventilators, but those breathing machines for the most critical COVID-19 patients are in short supply. That's why state health leaders are meeting today to figure out what can be done beyond building makeshift treatment centers.
We're up to the challenge, and we'll do the best that we can.
Nurses like Anthony Chiampa also concerned by shortages of protective gear. The State Nurses Association calling for more N95 masks. The city has asked for $2.2 million from the government, but in the meantime, the CDC says regular surgical masks are an acceptable replacement.
Not really feeling too great about using lesser protective equipment, but certainly we want to be able to protect ourselves as best as possible so that we can deliver the type of care that we need to.
Sick doctors and nurses would only intensify the crisis, but as Governor Cuomo warns of the reality ahead, he offers perspective.
It is a frightening time on every level. Is it 3 months? Is it 6 months? Is it 9 months? I don't know, but it's this much time. We're going to be challenged and tested. There's going to be periods of chaos. Yes. We've been through that before also. But this is all we're talking about.
Governor Cuomo compared this to those snow globes you would shake and the entire picture inside changes. He said our whole country's been turned upside down. Everything feels different now. And he asked New Yorkers to have compassion and show more sensitivity to help us get through this difficult time. In Washington Heights, Adam Cooperstein, News 4 New York.
All right, tonight we have learned that 4 players with the Brooklyn Nets have tested positive for the coronavirus, and at least one of those players is showing symptoms. We go now to News 4's Bruce Beck joining us live from the newsroom with the latest details on this, Bruce.
Natalie, the Brooklyn Nets have become the latest NBA team with a confirmed case of COVID-19, and superstar Kevin Durant has confirmed that he is among the 4 players who tested positive. Durant hasn't played a game this season, but traveled with the team on its last road trip. He was in street clothes for the Nets' last game exactly 1 week ago in Los Angeles against the Lakers. KD told The Athletic late this afternoon he's feeling fine and added, quote, "Everyone be careful, take care of yourself and quarantine. We're going to get through this." Brooklyn is in the process of notifying anyone who had known contact with the 4 players, including recent opponents. Since March 5th, the Nets have played the Celtics, Grizzlies, Spurs, Bulls, and Lakers. The Nets spent last Wednesday night in San Francisco, where they were slated to play the Warriors on Thursday night. In a tweet late this afternoon, Mayor de Blasio said, "We wish them a speedy recovery, but with all due respect, an entire NBA team should not get tested for COVID-19 while there are critically ill patients waiting to be tested. Tests should not be for the wealthy, but for the sick." The Nets joined 2 Utah Jazz players, Rudy Gobert and Donovan Mitchell, plus Christian Wood of the Detroit Pistons, as NBA players who have tested positive for COVID-19. The league suspended the season following games last Wednesday night. Chuck?
All right, Bruce, thank you. Now, keep